Hi there, and welcome to Lesson 1.4, Healthcare Literacy, and how it affects every choice and decision that we make in our care. In this lesson, you will learn how improving your health literacy skills helps you to identify, qualify, and obtain healthcare services more easily. This lesson also examines how low health literacy may become a catalyst for confusion, oversights, and errors, and how it may impact your ability to make sound judgments. So we will go through what you can do to prevent them from occurring just by simply learning how to speak the health professional's language. This video may go a little fast, so if you haven't done so already, have the presentation notes in front of you. And be sure to watch the video all the way through for the first time, and then go back to the parts that you need more clarity on. And after completing this lesson, you will have a clear understanding of how health literacy levels affect your health, as well as your success in treatment. And your lesson takeaways will be a clear understanding of how health literacy affects your healthcare use, status, costs, and outcomes. Clarity on the concept of the small, big, small picture and grasp why it is important, as well as master medical jargon and terminology. Now, in order to achieve our knowledge goals, we're going to see how Sally continues to improve her health literacy skills. Then, we're going to walk through the small, big, small picture, and then we're going to take a deep dive into the health professional's language, also known as medical jargon and terminology. First, let's define what is health literacy. Healthcare literacy refers to the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. There are 4 primary contributors that affect health literacy, which are healthcare use, healthcare status, healthcare costs, and outcomes. Meet Sally. She gave us the green light to follow her throughout her diagnosis and how she became the best patient advocate in her health. Sally self-manages care with the assistance of her daughter, who lives in the next state. On the first line of business, Sally documents her healthcare use, which is her compliance of the process of being able to follow the rules, regulations, and laws as they relate to her doctor's orders. The second way that Sally became an exemplary patient was by tracking her health status. And she did this by simply periodically reporting to each physician about her care. And the third contributor to Sally's healthcare literacy skills was her ability to document and organize her healthcare costs. And the last contributor is healthcare outcomes, which is the ultimate state in how she ended the condition. In a nutshell, Sally was able to give outcome measurements, which is simply the experience and the costs throughout her care. Now here's Sally. This is how her health literacy is measured, by her use, status, and costs that equal to her outcomes. Now, let's take a look at the small, big, small picture. Sally documents and records her healthcare experience and cost to the physician. Then, Sally's medical record is stored in the physician's electronic database. Then the practices and their patients' information is then collected by large health organizations. Those large organizations then take the information and dissect it into statistics. And the physician researches all of the information and statistics in the database. Then that research paves a way for the physician to see a big picture and then narrow it down to an individualized small picture. So here's a recap of the small, big, small picture. Patients supply physicians with their information. The physician documents their patient's information into their electronic health record, otherwise known as the EHR. The EHR holds the patient's information along with the practice's information, such as their demographics, and supplies it to big databases and governmental organizations. These data processors then have this information for physicians to research. Along with this research and previous experience, the physician is able to supply their patients with individualized care. And that is how the pre-calculated healthcare information helps the healthcare professionals guide Sally, along with all their other patients, for whatever health issue may arise. In the next line of business, we are going to look at medical jargon and terminology and differentiate the two. Medical jargon is commonly used terms and words that are used inside every practice. They have multiple meanings and a broad description, and they differ from office to office. Medical jargon are commonly used words with broad meanings. For example, negative. Doctors use this word to mean normal. Idiopathic is a term where doctors use where there is no concrete explanation of what's causing the patient's symptom or condition. Another example is the word cancer, which refers to a general term of a large group of diseases that have uncontrolled growth and the spread of abnormal cells. But with medical terminology, it is a universal description used to precisely describe the human body. This includes components, processes, and conditions affecting it, as well as the procedures that are performed. The anatomy of medical terminology is first the prefix. A prefix is placed in the beginning of the word to modify or change its meaning. Pre means before, so prefixes may also indicate a location, number, or time. The root is the central part of the word, and the suffix is the ending part of the word that modifies the meaning. Prefixes come before the word in medical terminology. Some examples are osteo, from the Greek osteon. Bonosteomyelitis refers to the inflammation of the bone and marrow. Patho, derived from the Greek pathos, meaning suffering or disease. Trans, from the Latin meaning access over or beyond, which in medical terms contain trans and are many, like transfusion or transplant. Suffixes come after the word in medical terminology. Some examples are pathy, which is disease neuropathy, which is referred to the disease of the nervous system. Itis, which is inflammation hepatitis, which refers to inflammation of the liver. And ology, which is a study in science of cytology, which is a study of cells. We've covered a lot. By being proficient in health literacy, you're able to showcase your health story and ramp up your good communication skills. And like Sally, allowing you to even better prepare for your office appointment. And that concludes our video for today in learning how leveling up your health literacy skills impacts every decision and choice that you make in your care. And be sure to join me in our next course, where we will take a look at ancillary care and see how it is a great supporter for our providers and point-of-care services. Bye for now.